We're going to position for lateral C spine and cross-table lateral C spine. We're going to start with an SID of 72. This allows for the magnification of the shoulders to be reduced. And I have placed my X-ray tube at that level. I'm also going to ensure that my patient doesn't have any jewelry, necklaces, or anything in the area of interest before I take this image. And I'm going to ask the patient to stand nice and tall or sit nice and tall in an erect position and close to the IR. I'm going to use an IR of 10 by 12 lengthwise. Place my marker in the collimated field. And I like to place my marker right there. I'm going to collimate to 10 by 12 as well. As far as the patient positioned, if the patient's shoulders are naturally forward, you may ask the patient to roll their shoulders further forward. If they're standing straight and their shoulders are naturally backwards, ask the patient to roll their shoulders back. So this way the shoulders are out of the way of the lower cervical spine. This patient's shoulders look like they're forward, so I would ask this patient to roll their shoulders even further up, forward. My central ray is going to enter at the level of C4. So I'm going to adjust that. It's also going to be entering at the level of the mastoid tip. And then I'm going to ask the patient to take a deep breath in, blow it all the way out, and hold their breath. And they can breathe. Asking them to hold the breath on expiration further lowers the shoulders down so that we can see the lower cervical spine. If a patient's unable to depress their shoulders enough, you can also put weights around their wrists. That's lateral C spine. In this projection, you should see between C1 all the way to T1, and you want to see the interspaces of C7 and T1, that disc space clearly. You also want to see the top third of T1 clearly. If a patient is a trauma patient and they're not able to sit up or stand, you can do a cross-table lateral C spine, and you can do this with or without a grid. I'm going to use a grid. I like grids. So make sure you have a good technique for both. Some patients, if they're small and their shoulders are narrow, not necessarily going to need a grid. I'm going to use my grid holder and place that this way. Now, if you're using the table for positioning, you may want to lower this IR with the grid below the tabletop, because we don't want to cut off the back of the spinous processes, especially in the lower portion of the C-spine. So one thing I could do, if I don't have, for example, stand or a cassette holder in a stand, I can probably use this as a stand. I want to make sure my patient is as close as possible to the image receptor. I'm going to place my right marker here. And I'm going to want to use as much distance as possible. Again, to the reduce magnification of the shoulders. My centering is going to be the same, C4, at the level of the mastoid tips. I'm going to go ahead and ask the patient to depress their shoulders as much as possible. Center my IR. And make sure that when you're doing this position or the erect lateral, the mandible is out of the way. So you may want to raise the mandible just slightly so that the angles of the mandible are not over the cervical spine, but again, not too much so that the spinous processes are not obscuring, are being obscured by the occipital bone of the skull. Again, make sure the patient's shoulders are relaxed. You have a shield. The head is nice and straight. And then you'd ask the patient again, take a deep breath in, blow it all the way out, hold your breath, and you can breathe. And that's it for cross table lateral C-spine and lateral C-spine.